Hey guys, Dr. Pete here today with Casey.
Hi.
Casey has volunteered to share his story with his chiropractic care. It's a pretty cool one. Some of you may relate to it. So, Casey, I met you, I think it was in August of this year. So that's about 3-4 months ago.
Yep.
When you came in, I remember, but tell our viewers what was going on with you.
I was not really able to move. The back pain has limited my mobility. I could barely stand up.
Yeah, when you came in, you were like
tilted
far over the side and had a lot of muscle spasm in your lower back, right?
Correct.
How was that affecting your life?
I couldn't do anything. I could barely move. I was out of work for a little bit. Then I came to see you.
Yeah, and for the viewers too, like you're a young guy, but this wasn't your first time having any back pain, right?
No, I had back pain maybe a year or so before. Ongoing every couple of months.
Right. So it's sort of becoming a chronic problem.
Absolutely.
Right. And for you guys watching, I'm not sure why, but I'm seeing more sort of younger people with back pain. So whether it's teenagers or people in their 20s or early 30s, it seems like I don't have statistics, but it seems to be more frequent. I'm not sure if, we're growing up on our technology and our phones and your job is sitting at a desk. And how long have you been doing that, Casey?
5 years probably,
yeah.
6 years, yeah.
Yeah, so maybe that was starting to accumulate. And when you came in, do you remember the testing that we did?
Yes.
With you? What did we do?
I tried to do like equal balance with my weight, strength test, my arms and legs.
Yeah.
Obviously I failed miserably.
Yeah, and I don't know if you remember this too, but I know we talked about this, but what was an area of your spine that was a problem that maybe you had not thought of? Do you remember?
Ooh, I don't know. My neck.
Yeah, your neck. So like your pain and symptoms were lower back, but you had a lot of forward head posture. And that can, the spine is 24 segments, then we have the skull and the pelvis, and people think of okay, you have low back pain and that's where the problem is, but you have to, biomechanically, each of those 24 segments has to be able to move. And so you can have problems, you can have pain in the lower back and actually have loss of spinal mobility at areas higher up that's affecting the way the spine as a whole moves and then leading to problems. And usually those things, they start to accumulate over time. So, but we've been adjusting you. That's pretty much the main thing we've been doing with you. Yeah. So what's changed for you in the last few months?
I can walk.
Yeah, that's good.
I can walk, pretty much back to normal.
Yeah, you can sit at your desk.
Sit at my desk for full day, no problem.
Great, great.
Yeah.
Okay. And I know when we chatted in the beginning too, one of your big priorities was sort of to take care of this so it wasn't a problem going forward, right? So that's what we're doing with Casey. So we're going to show you how I adjust Casey, and again, we're not just limiting to lower back. We check the entire spine when we do an adjustment and make sure that we can sort of get everything on a particular day moving. So we'll do that. So let's go, we'll take your glasses off there, Casey, and I'll get you lying on your stomach and just show our viewers how we do a typical visit. So the main thing that I do with my patients is a palpation check of the spine for the adjustment, so to determine what needs to be adjusted. So as a chiropractor, your tools are your hands, and as you put them over the spine, you can certainly feel areas of muscular tension. So for today, and you can almost kind of see for Casey, beside the right shoulder blade here, these are some of the deeper spinal muscles, and they're kind of ropey and tight today. So, and he has some restriction in his upper thoracics here, so we're gonna adjust that area. If we scan a little bit further down, really important joints are the two sacroiliac joints here at the base of the lower back. And so his left side and right side are a little restricted. They're a lot better when compared to when Casey first came in, and these SI joints were really locked and these low back muscles were in spasm, but we're going to adjust them as well. And then we'll check his neck with him lying on his back, which is one of the ways that we do that. So let's start, Casey, with you lying on your side facing me, please. So different ways to adjust the sacroiliac joints, but this is a side lying adjustment. It's very effective in many cases. It can also be done, however, with a drop table, but we're doing the side lying adjustment today. So I'm coming on to that sacroiliac joint and just great. Flip on the other side, please. Now Casey's one of my favorite patients, and there are several reasons for that, but one of the main ones is that he's a Buffalo Bills fan, so I don't know if I'm allowed to share that.
Oh, absolutely.
You're proud of it. Okay, we're having an interesting
year.
season here, but we need a win this weekend. Excellent. On your back, please. And just slide down a little bit. And during the process, I'll ask you too, Casey, the adjustments have been pretty comfortable, right? They haven't been painful or anything.
Not at
right?
all.
Good. Okay, so we're gonna here. Take a breath in. Let it out. Fantastic. Okay, I'm gonna come over to the head. You can.
Yeah.
Here. So for the neck, again, I'm coming in and I'm feeling, so we start at the base of the neck, the first ribs, seeing how they're moving. Right side is a little bit restricted. Is that a little bit tender there, Casey?
Yeah, just about.
Left side is not as bad. And we just palpate each of these joints along the spine. And then I feel up here in the little tender there, correct? The left side, so left around C2, C3. So the big thing that a chiropractic adjustment can do is bring motion where motion is restricted. And by bringing better motion to the spine, that normalizes the biomechanics of the spine, how it moves, which a lot of times will decrease areas of pressure or inflammation or irritation of nerves. And that's what creates a lot of the positive changes for chiropractic patients. So we're gonna do that adjustment. If you're watching too, if you're a chiropractor watching this, bear in mind as well, my posture is important too to protect my spine. I got a spine too, just like the patients, and we have to be careful with our postures to avoid getting injured. So with this type of adjustment, I'm getting into a squat position. We come on to just let your head drop there. Good. And then for the first rib, and same thing, just let your head drop a little bit more. A little bit more, drop down. There we go, that's better. Okay, let's get you up to sitting, face that way. So, I'm gonna come over here if you want a camera person, come over here.
Yep.
Thanks for sharing your story.
Yeah.
Anything else you wanna tell the viewers?
No, come see Dr. Pete.
Wow, go Bills.
Go Bills, go Bills.
Thanks for watching, guys. This is my disclaimer. So the results Casey's getting, they might be possible for you, but there's no guarantee of that. And please do remember that, we really care about, I really care about the patients here and do my best to help them, but there are probably many good chiropractors in your community who can help you out. If you do want to come here, we're located at 2012 Victoria Avenue in Burlington. Phone number is 905-634-9494. And I hope you find the videos educational. And thank you for watching. And thank you, Casey, for
Thanks for
sharing
having
your
me.
story. See you at the next one, guys.